And so it's like, okay, well, what can we do to further enhance and just bring her that refreshed, still her, but that refreshed version of herself. Also, and I think this is important too when you're doing assessments, is to look at like the overall emotion that's coming out from the patient. And, to me, like, I want her to look happy. She's actually very kind, very gentle, like, individual. I want her to have that expressed outwardly, where it's like, okay, I feel refreshed, I feel calm, I feel peaceful. I see just a little bit of asymmetry in her halves of her face, where this one just has more natural volume here. This side, you can see that light shadow where there's light reflecting here, there's light reflecting here, there's light reflecting here, and then it's kind of a dark shadow in here. I can't remember. I guess I could with like Kybella maybe, but looking at her, it's like, okay, how do we balance these two sides out and make it look symmetrical and look the way that we were wanting to? So on her, I see that she needs a little bit of volume throughout this region and then coming up into her tear trough. Whereas on this side, and you know what, lateral as well, we needed to widen her out. Whereas on this side, she actually has more width to her entire face. So that's why having that lateral cheekbone on this side is going to be important, because we need to widen this side out more. So apex, for sure, like we want to augment that apex. I want to augment this apex because it's kind of flat here. There, and then I want to add that product all throughout here. So actually her jawline's pretty good, but she has this heaviness. We don't need a whole lot on her chin, but we do need, in terms of, shape, we are going to project it. And I know you guys can't really see that from these side angles, but she did need outward projection. And we did just the tiniest bit of downward projection too. This was going to be huge to help with that chin or the jowling that you're seeing. This heaviness that you're seeing here and here is going to be a combination of the cheek, the chin and chin shadow, and that jawline. All of those points are what are effective at helping with that gelling. So our plan for the lower face is going to be the tiniest bit of length, projection, chin shadow, all the way across, treating this whole area. It's kind of our plan for her chin.